Hello, my name is Décio Temporário, and I'm here before you today to mention something that was very important to me, and a good old friend of mine gave me this idea of taping it, something that I wrote a long time ago. You know, we as patients, we already trying to bring our voice up and to be properly heard, to help some international or landline organizations that are doing their best in our behalf, sickle cell and thalassemic in this case. In my case, one part of mine, I'm truly thankful for it, because I know if we persist with it all together, the future generations that will come will probably be more aware of this awful and problematic disease. And hopefully, with better guidance and respect and access to treatment, this all can be better. My personal experience with this sickle cell and thalassemic disease is like, it's awful. The cause itself, the understanding of the situation along the time, the rejections, the conscience about the realness of it, the deep scars that this disease leave inside us, not only physical but most of them mental. It's dubious. It's not even imaginable. And we say that our physical part is hurt, but our mental part get worse than our physical. That's what I think. So living with all these diseases in my life, I felt the necessity to build up another persona that will take this on an easy way, getting up 8 times or falling 7. That was me. It's not easy to live inside a constant broken body. You have somehow to have a courage to build yourself up and up again, because there is nothing else you can do about it, actually. Well, some of you will say, yes, you always have a way, just accept your conditions and it will definitely be easier. We have a choice, and for me, we have 2 choices. Sink in the given information that they gave you, shut our mouth and transform your thoughts and try to see if it fits you, or can be a little bit like me, constantly frustrated about what I have, because you do not see yourself and accepting yourself as a persona that simply cannot do certain things. I didn't accept that for myself, and it continue our path as hard as it can be. I always believe that I dictate the end of myself or my journey in this world, and not the disease. Well, for most of part of my life, I chose the second part, just to be me, fall 8 times, get back 9, try that type of mentality that gave me the boost that I needed and the attitude that I needed back then to go out there and actually explore the world as someone without my conditions would do normally. Well, I played football when I was a little child, surf, I did jiu-jitsu for 22 years. I played basketball as higher level, as the highest level you can get. I played pro for 4 years. So for a long time I pushed myself to the limit, living on the edge. That's the fine line between going to have a crisis and not, the total danger of it, but the will to strive better, study harder, and put myself in a position of a choice. That choice it's an harder one to complete it and try to get it, but is one of that if you work hard enough just to prove it to yourself, most of all, but to all the other people that live beside you and see you on your own journey, people that are important to you as well, see that you are stronger than a label that they give you when you're like 4 years old, when I was me, or when you're born. You know, this mentality brought me a lot of goods. I can't deny. But the way I used my knowledge about certain things, I kind of danced with it, and that broke me inside out. So I'm here today to tell you that I'm very lucky. I'm a survivor. We all are. But I'm here today as someone who struggled a lot and still struggles a lot mentally. I was addicted to painkillers for a long time. I was that someone that took the word reckless to the max, and it got me to this stage. The understanding of your behavior as a sickle cell and thalassemic patient grows inside you, so you kind of learn how to cheat your body and your mind to certain things that you normally can't or shouldn't do. That's what we do as patients. In my case, was the painkiller stuff. I was very aware of what I would take from that, because I wanted painkillers to go on and just do the normal life that I always wanted to. But I knew if I had a little bit more pain than I had, that could escalate for much worse, and that was a wrap for me. So I overused painkillers just to help me get the right way. No step backs on building my empire, my practice, my clinic, my dream job. Working with athletes, that was always my thing. My contribution as a citizen too, as a man, as a husband, and most importantly, as a father. If I'm not able to share with my daughter what daddy had to do in certain points of my life, and if I can be honest about it, I'm not teaching her nothing. I'm not teaching you nothing that you already know, right? So all I wanted was to to keep the ship on the right path, avoiding it from sinking, stay away from strong currents, and be able to give my all hand for the ones I loved the most. That was for the ones I love the most. I did that for them, and I do it for them. Okay, and I don't regret it, because if you ask me if I do it again, yes, I'll do it probably again, the same things. So sickle cell crises are just beyond the manageable, with frequently crucial, exuberant, uncomfortable pain. Meds like morphine did not help me at a certain time, so I began to use fentanyl mixed with morphine. As the days went by, the overuse of these drugs got worse and worse. Deep inside, I knew I was doing the wrong way, but when you enter a path that you got to be always available and suitable for work, or just for a minor family activity, it's so easy to ignore these facts and just get along with it. But what I forgot is sometimes we are not capable of holding that kind of things for much longer. So, and I couldn't control it. I lost it. I lost control about it. No excuses, but it became an actual addiction of those painkillers, a big problem, and I didn't know how to resolve it, or better, how I got the proper help with this problem. Simply because I was so ashamed of what I did, and so ashamed the spot that I had in this community as an health professional too, to a father, I mean, and using it is just too imaginable. And be able to hold on the pain that I constantly felt a little bit longer than before, that's the main thing. But also to make me rest a little bit better, forgive the problems, and just simply fade away in the rest. By then, the lack of sleep and the overuse of the pills got me to a resort far worse than I possibly accepted. There was a terrible scenario, actually. From last year's rhabdomyolysis, acute muscle destruction, to organic sepsis that generated hepatic and kidney failure, to lead to 2 complicated heart attacks. Not done with it, after a long time of dialysis and blood transfusions, I got bilateral pulmonary embolism, and our late friend COVID too. So it was very, very bad. But God didn't left me, and my closest ones too. They didn't abandon me, nor judge me. One thing that I was afraid of was this situation that I could have avoided. Was this episode a reflection of my behavior? Yes and no. I'll say yes, because I was reckless with my medication, and the way I used it, and the mindset of putting everyone and everything else before me. For that, yes and no, because only God knows what will happen to you on a certain point of your life, and I experienced that very close, even with good choices. So today I can look back at it with a more mature and solid mindset that I could not develop till this awful experience. I'm still fighting, I'm still figuring things out, not because I know that I'm a warrior, but because I want more from this beautiful life. But I want to be just a simple, humble man. Luckily, now with the multidisciplinary team, the hematology, the cardiology, the neurology, physical therapy, the psychiatry, the psychology, and the pain management, all of these multidisciplinary teams are helping me actually manage the puzzle on my lows and empowering my highs. Keeping this balanced, not easy. It's not easy. It gets frustrating. And sometimes you don't see that you are that grateful enough or lucky enough to be here in this earth for the things that you did, for the reckless behavior that you had, and for that I say that mental health is one of the causes of our sickle cell and thalassemia crisis, for sure. And we at patients, at some point in our lives, we are always going to have problems, desires, or whatever it may come across. But as human beings, you are going to fail for the most part of our journey. That's a part of it. By failing, you learn. And by learning, you become yourself. Right? So be thankful. Because the beautiful thing that we got to understand and actually believe in is that we are not alone in this. We have family, we have friends. In my case, I have a super human hematologist. That's a superhero. That's from another planet. And all of them love us unconditionally. And they are so supportive, even when we think we are being misunderstood. This part of people, doctors included, are here for a good reason, to help you along your journey. And now I choose to believe whatever your problem may be, because there are a lot of different types of problems and approach of it. I don't say don't copy me, because don't copy me. My life was good, is good, and it's gonna be good. But it's my life. Even you with your life, with your struggles, you can see the sun shining. So stay healthy, stay strong. God bless you all.